The brain contains the densest vascular network in the human body, 1.6 million kilometers of blood vessels nourishing countless nerve cells. But whilst this network has helped endow humans with greater intelligence, it's also what makes the human brain especially vulnerable. In China, on average, one person experiences an acute cerebrovascular disease every 10 seconds, and one person dies from it every 28 seconds. Are we doomed to live in fear of disease? How should we respond? Cutting open the scalp, removing a section of skull, then incising through the meninges. The surgeons are operating on the brain, the organ we are most proud of and which governs our thoughts and actions, to defuse a lethal bomb on one of its blood vessels. This is an intracranial aneurysm, a bulging blister on the blood vessel. Blood is surging into the blister. Each impact threatens to cause the paper-thin vascular wall to rupture suddenly. Even the slightest cough could be the straw that breaks the camel's back, with potentially lethal consequences. Bleeding from a ruptured blood vessel in the brain is known as cerebral hemorrhage. The brain tissue, as soft as tofu, suffers fatal damage due to the sudden rise in intracranial pressure and the impact of the uncontrollable blood flow. It is said that it could cause the most severe headache a person can experience in their lifetime. This is a famous photograph in both world and medical history. Winston Churchill, Franklin D. Roosevelt, and Joseph Stalin, three giants in the World Anti-Fascist Alliance, were ultimately defeated by the same enemy. It is said that they died one after another from the rupture of this deadly blister.
就是能瞬间导致人死亡的疾病，第一个是脑动脉瘤，1秒钟人就死亡。 所以这是最危险的颅内动脉瘤。
这个破裂以后呢，大概有40%的病人呢来不及去医院，直接就死亡了。
Confronted with the most vicious cerebral vascular diseases, many undergo craniotomies, a price they have to pay. An exposed brain allows physicians to eliminate the enemy in the most direct way.
只需要在外面用一个夹去把这个动脉瘤夹住这样的话它就会避免血流进入到动脉瘤里，它就不会再出血了。
This highly invasive surgical technique was a groundbreaking innovation over 80 years ago, once regarded as the gold standard for conquering the fatal blister. However, this is not the end of the story. Four-year-old Kirka is a lively and energetic girl.
妈妈，好像这个不眼色了吧？好像这个
不明显了吗？
However, recently her mother has forbidden her from running and jumping.
她是一直没有症状这一年，开始这1个月，然后就会头痛，然后就会吐，吐了之后她就会好受很多。
After multiple examinations, physicians discovered an aneurysm, about 3 to 4 centimeters in diameter on her cerebral blood vessel.
这个动脉瘤
目前来说已经不用开颅夹壁的方法了，因为它血管比较迂曲嘛，又有一些分支，我们必须得保证这些分支的存在，所以我们不能一下就给它闭死。
Kirker's large aneurysm is at the junction of several blood vessels. Opening the skull to clip it would not only cause tremendous trauma to her young body, but also compromise the normal blood supply to the other vessels. Challenges like these really test the limits of traditional surgical methods, but the unfortunate reality is that cases like these are far from uncommon. Since the beginning of the 20th century, advancements in technology and materials had enabled physicians to constantly push the boundaries, searching for a revolutionary method to eliminate the fatal blister without opening the skull, the holy grail of medical science sought by physicians right across the world. Little did they know that a great transformation was taking shape, one that would change the course of humanity. In July 1964, a physician at the University of Chicago unveiled to the world his bold endeavor. He administered local anesthesia to a patient with an aneurysm, drilled a hole in his skull, and then inserted a stainless steel needle into the aneurysm within the brain through the hole. Then he charged the tip of the steel needle. The electric current disrupted the original equilibrium of the blood, activating one of the most common yet vital mechanisms in the human body, coagulation. The continuously forming blood clots embolized the originally hollow blister, transforming it into a solid blood mass.
血栓形成以后，就把这动脉里闭掉了，把这动脉里的血跟载流的大血管分开了，它没血了。
This is the surgical image from back then. We can see that over time, the blood carrying the contrast agent could no longer enter the aneurysm. In time, the solid blister, having lost its potential to cause brain damage, faded from the image. However, even despite its less invasive nature, this surgical approach did not quite live up to its promise, largely because of unavoidable complications. Still, it sparked innovative ideas that could transform craniotomy. For instance, reaching the aneurysm through blood vessels and inducing a thrombus to block it was seen as a simpler, more effective approach. Wu Zhongxue is one of China's earliest pioneers in endovascular aneurysm treatment. In the course of his long career, he's gathered many mementos, including a number of tungsten wires purchased from a light bulb factory. In the 1990s, he delivered these soft and thin metal wires as safe embolic materials into patients' large intracranial aneurysms.
病人的这个满院都是50、60个病人呢，都在担架上搁着。逼到这儿的时候，你不管用什么手段把病人的命救回来，这是最大的，命比天大。
However, before that, like pioneers worldwide, he first needed to overcome a major challenge. Without the most direct and open surgical window provided by craniotomy, how could these metal devices be safely and effectively navigated from the thigh all the way into the intracranial aneurysm located over a meter away, relying solely on thin and tortuous blood vessels?
可以顺着这导管送到这个动脉瘤里面，它是不可控制的。你进去之后就拿不出来，你如何放置它也没法控制。
Like firing a slingshot, there is only one chance to insert the tungsten wire into the fatal blister. Therefore, any misplacement or accident could cost life. Enormous surgical risks obstructed progress, but an unexpected discovery changed everything. The University of California, Los Angeles is a world-renowned university, the wellspring of a host of world-changing inventions. It also plays host to a veterinary operating theatre that has more than earned its place in medical history.
As you can imagine, we come from a door and the swine is already in position and is asleep. And Dr. Guglielmi is on my right, and I am here.
Over 30 years ago, right here, the young Dr. Fernando and his close friend, Professor Guido Guglielmi, constantly experimented with a more innovative method for aneurysm embolization.
I attach the micromagnet to the tip of a stainless steel wire. Then I would inject iron microspheres, which have a diameter smaller than the red blood cell.
Guglielmi placed a micromagnet inside the aneurysm, using its attraction to draw in the iron microspheres, precisely guiding them into the fatal blister to facilitate blood clotting.
But it was not working because the micromagnet would attract only not enough iron microsphere. So I decided to change path.
Soon, Guglielmi, who had extensively studied electrocoagulation experiments, had his eureka moment. Maybe he could apply a 4 milliampere electric current to a stainless steel wire connected to a magnet, hoping to induce more blood clots to completely embolize the aneurysm. Everything seemed to be going well until disaster struck.
And I applied the current, and I realized the last portion of this wire, stainless steel, detached from the rest of the wire.
The guide wire had been fragmented by the electrical current. Still, despite failure, that trial nonetheless saw the birth of an ingenious method for controlling embolic materials. Guglielmi quickly realized that entering the fatal blister was no longer a formidable challenge. As long as the material remained connected to the guide wire, the physician could adjust its position at any time, like flying a kite until everything was satisfactory, and only then detach it from the guide wire.
We start pushing the coil through the microcatheter.
After countless experiments, Guglielmi introduced to the world this device that completely changed the status of craniotomy, the Guglielmi detachable coil.
The fact that my father had a ruptured aneurysm in 1974, it was a kind of a dramatic experience for me. Pushed me to continue dreaming of the idea of treating aneurysms in a less traumatic way.
On March 6, 1990, Guglielmi and his team completed the world's first clinical trial using Guglielmi detachable coils. It was his profound love for his father that gave rise to a method that brought hope to countless critically ill patients.
The first clinical case, which went very, very well. We did an angiogram and the aneurysm was gone. So the coils worked. We were so happy.
Today, minimally invasive coil embolization has supplanted craniotomy clipping as the primary treatment for intracranial aneurysms. Beginning their odyssey at the femoral artery near the groin, these mini-warriors have to traverse most of the body before fulfilling their quest deep in the brain. The placement of coils is an exceptionally delicate process.
我们放出去以后不满意，我们可以收回来重新放，再不满意我们可以拿回来再换一个，这叫可控，所以这个安全度就大大提高了。
Only once everything is satisfactory will the physician detach the coil from the guide wire, leaving it permanently within the aneurysm. Once inside the fatal blister, the densely interwoven coils get to work, slowly but surely transforming the blood into a thrombus. Thus, a sturdy fortress obstructing potentially dangerous blood flow comes into being. Cunningly, from within, the time bomb has been deactivated.
It was very successful. It's a milestone, it's a revolution, it's a tremendous step. It has revolutionized the treatment of aneurysm.
Now, with even more non-invasive procedures, endovascular treatment is getting safer and more effective all the time. But whenever a bright new era dawns, it's far from plain sailing. New challenges are bound to come pouring in, one after another in quick succession. Seeing her father off to work from the windowsill is Kirka's most important daily ritual. Treating the aneurysm from within the blood vessel represents this small family's last hope. Yet Kirka's condition is far more complex than imagined. This describes a typical intracranial aneurysm with a short connection to the vessel like a narrow-necked pocket. However, Kirka's brain blister has a wide neck.
流经很宽，不适合单纯用弹簧圈进行栓塞。弹簧圈，在这个宽颈里面待不住掉出来了之后，会造成血管的闭塞。
Irregularly shaped complex aneurysms pose a new challenge. Undaunted, doctors gradually focus their attention on the very origin of this nightmare. This is the science about flow. Within the narrow and winding passage, the rushing blood continuously impacts the vascular wall, exerting immense pressure on it. If a vertical tube were inserted into the blood vessel, blood could shoot up to over 1 meter high.
那动脉瘤本质上当然是因为血流对血管壁的冲击造成的。那血管壁如果这个地方比较薄，或者因为一些先天或者后天的原因导致它一些受损之后，容易引发这个动脉瘤。
This experimental report was published in 1997. Through the special fluorescence development technology, scientists were able to simulate and calculate relevant parameters such as blood flow velocity and pressure within an aneurysm. The author of the report is the internationally renowned neurointerventional expert Ajay K. Wachlu. Prior to this, he had already dedicated himself to studying the pathogenesis of fatal blisters. After progressively clarifying the close relationship between blood flow and the blisters, he developed a groundbreaking design. Using a fluid model simulating the cerebral vasculature, we can clearly observe how a novel device works its magic. This is a metal tube perforated with countless tiny holes across its entire surface. When deployed at the joint between the fatal blister and the blood vessel, it functions like a fine sieve, filtering out a substantial portion of the blood originally rushing into the blister, thereby reducing the pressure exerted on the fragile vascular wall.
And as you see, the water doesn't spill between the mesh. This is basically cohesive forces that you are observing here. And I can bend the device, and you see the water is still trapped inside the mesh.
The key to success lies in mesh density. Dozens of alloy wires as fine as strands of hair are ingeniously intertwined to ultimately form a tubular metal mesh with a porosity of approximately 70%. But little did anyone realize that the development of this design, known as a flow diverter, had a huge surprise in store.
After we placed the flow diverter, and then you saw something amazing. What we saw is that suddenly these aneurysms would disappear and geographically disappear.
它里边流速和流量都会很小，慢慢就会形成血栓，动脉瘤囊里边就没有血流这个流进去了，这动脉组织慢慢就吸收之后，变成一个正常的一个血管。
This represents yet another breakthrough in treatment technology. A small metal tube not only prevents the intracranial bomb from detonating, but also addresses the root cause, reducing the blood flow's impact on the fragile vascular wall, much like defusing a deadly bomb. Today is a wonderful day for Kirka.
对，我们可勇敢了，是不是？
She is going to drive her ride-on a special hospital adventure.
你听阿姨话啊。
They have worked hard to bring new hope to this young life. Soon, the large and complex aneurysm was clearly displayed on the screen. Inside this catheter, just 1 millimeter in diameter, is the flow diverter that will soon change Kirka's fate.
很多原来手术和传统介入的办法治疗不好的一个动脉瘤能够得以治疗。导管一到位，把它推送进去，把导管一回撤，就把这个支架放在那儿了，就等着动脉瘤自己在修复，也是革命性的一个变化。
Just as intended, Kirka became the proud bearer of a flow diverter. The successful implantation of a flow diverter eliminates the threat of the sudden detonation of that lethal bomb, putting Kirka firmly on the road back to vitality and health.
做血管病的这个专业的医生，必须要掌握介入和手术，就是判断这个病人的时候，哪个操作更好，哪个技术对病人更有利，你就可以选择什么。
Strange as it may seem, a tiny blister can be a deadly bomb. But thanks to extraordinary willpower, patience, courage and ingenuity, scientists and physicians are constantly opening new pathways into the cranial cavity, thereby opening new fronts in the war against cerebral vascular disease. Thus, battling against the odds, medical science is bringing hope and new life to millions of people all around the world.